TGIF and all that. But we're going to feature the Pagosa Springs Medical Center today. And in the studio, Tamra Lavengood and Phil Zappone. You guys have been here before. Welcome back.
We have.
Thanks, Will. Thanks for
Good
having
morning.
us.
How you guys doing?
Good.
Excellent.
Fine, thanks.
Happy New Year. I haven't seen you.
Yeah.
Having a good New Year so far?
So far, so good.
Yeah.
Yes.
It's almost February. Oh,
I
boy.
know.
So that's great. Well, I know you've been here before, but do you want to start by just telling us a little bit about how you got here, or
sure.
what's going on?
Well, actually, I saw the beautiful full moon this morning.
Yeah, wasn't it?
And
the wolf moon. Ow!
Oh,
right.
That was good.
That's funny.
And then I drive from Durango.
Yeah.
And so it was a little icy.
There, yellow
but,
jacket maybe.
Oh, it was so pretty, though, coming into the valley. Yeah. The fog was all settled. It was really pretty.
Nice.
So,
that's Tamra's story. And Phil?
Well, I live fairly close,
yeah.
but I'm a nurse practitioner at the hospital in primary care, and here today to talk about some of the services we offer.
Nice. And Tamra, you're the
Phil,
clinic
so
director.
Yeah. So,
I've seen you over there.
I'm the director of the clinic.
Yeah,
and
that's awesome.
Yep. And so should I go ahead and just dive into this?
Oh, yeah, dive in.
So today what we're going to talk about is just prevention and just the different things that we can do to just keep us healthy. And so the main thing I want to tell you is that all of this information that I'm going to give is information that you discuss with your provider. And it's, totally up to the individual in terms of what they want to do with their health. So you really partner with your patients. In terms of prevention, there's probably three main things that we can do. Immunizations and cancer screenings and an annual wellness visit.
Annual.
Yes.
Not every 20 or 30 years.
I know. Isn't that the truth? Right. Well, and the thing is when your children, when we have kids, we're bringing them in for these well child checks all the time. And then when we're adolescents, we do sports physicals, but probably between the ages of 20 and 40, we don't go in annually for an exam. And those are the times that you can catch something and prevent these chronic illnesses that happen when we get older. So the main things that I'm going to talk about, first I'm going to jump into vaccines. And I'm going to just tell you what's recommended. But again, it is personal choice, and it really is discussion with your provider. So it's respiratory season right now. So the vaccines that are going to help us are going to be the flu vaccine, the pneumococcal, which is pneumonia, and then the COVID vaccine. All those are available in our clinic. The COVID vaccine is not going to be available in our clinic until the beginning of February.
Okay.
So, right, the most updated version. And so what's recommended, and this is recommended from the American Academy of Family Physicians. This is probably over 100,000 family physicians across the nation. And they really have recommended, vaccines. And they're worried about just the misinformation and, worried that it's a real threat to public health. It increases the patient, there's been an increase in patient hesitancy of these potentially deadly diseases, and outbreaks can happen. It's just really critical to protect our health and those around us. So that is a statement from the American Academy of Family Physicians. Now, the American Academy of Pediatrics, and that's about 67,000 pediatricians across the nation, and they're really committed to physical, mental, and social health and the well-being of our children, infants, adolescents, young adults. They strongly recommend immunizations as the safest and most cost-effective way of preventing disease, disability, and death in children. So immunizations have led to a significant decrease in the rate of preventable diseases. And the thing is, vaccines are probably one of the single greatest achievements in the past century. Vaccine development is a long and arduous process, often lasting, many years, involving a combination of public and private research studies. They've looked at the optimal timing, delivery of the vaccines, and they've, studied hundreds of thousands of children. This has been around a long time. They estimate the vaccines have prevented more than 12 million hospitalizations, 730,000 deaths among children in even just the last 20 years. Okay, that was just a lot of information, right?
I had a question just about COVID. Seems like people had been getting it there for a little bit recently, and then is that a vaccine of sorts?
Yes.
You've had it recently.
Oh, there's a series.
Some sort of time
It's a series of vaccines. Phil, are you better with this?
Is the question, should you get vaccinated if you've been infected recently?
Yes, that's kind of the question.
Yes.
Yeah, when you're feeling well, yes.
Once you're feeling well and stuff like that.
Right, you can get it again.
Yeah, that's what I'm seeing, right? That's
you can.
Kind of what I was wondering what your observations were, too.
You can get it again. The thing is that now we know so much more about the disease, is the treatment is much better.
Yeah, people aren't getting as sick.
Yes, right. So, but we have employees that are out with COVID, that have been vaccinated. We have employees out with the flu that have been vaccinated, with RSV.
They're moving targets, these
That's
things,
right, that's right. So immunizations don't protect you 100%, but they definitely provide a barrier. So immunizations, that's preventative. Those are things that we can take that help us stay healthy. Other things that we can do are going to be cancer screenings. And so there's several different, cancers that we can screen for, find, and prevent, which is really pretty cool. The cancer screenings, breast cancer screening, cervical cancer screening, colon cancer screening, prostate cancer screening, all of those are things that are readily available that we can do even as, younger adults. Now, with breast cancer screening, it's recommended, now you're not going to think this is younger,
Yes.
but 50 to 74-year-old women and even 40-year-old women, just depending on your risk factors, get a mammogram every 2 years. Cervical cancer screening with women, this is younger, 21 to 64. Get a PAP every 3 years. For colon cancer, now it's recommended, it was 50 to 75 years of age, and now it's 45 to 75 years of age. There's several different ways that we can test for colon cancer, several different tests. You can have the stool, sample that is a test. There's a test it's called Cologuard, where it's mailed to your house, and you just, it's a stool sample, and then you just send it back in, and it's really pretty effective. The thing is that if it is positive, then you have to have a colonoscopy, and then let me just back up. So with the Cologuard, it's every 3 years. If you have a colonoscopy, then it's every 10 years, unless there is, or polyps or something is found.
Right.
But the thing is, that is the ultimate best test that you can have is a colonoscopy. And then prostate cancer. And there's actually a blood test that males can have. And, depending on the results, every 1 to 2 years. But these are all things that you need to discuss with your primary care provider.
Are these all things that you can go to the clinic for?
Yeah.
Or do you
yes.
tell me that? Yeah, you prefer having the primary care.
That's perfect. So when you go and you talk to your provider, these things will be recommended.
Right.
They are ordered. The breast, a mammogram is ordered. We do have a 3D mammography machine. And then for colon cancer, absolutely, for a colonoscopy, Dr. Tingley and Laura Medina, Dr. Laura Medina, both of our general surgeons, they both do colonoscopies, so it's done right at PSMC. For the other two tests for colon cancer, those are things that we do on our own. But you have to have the kits. For cervical cancer, that's a pap smear. That is done right in our clinic with our providers. And then the prostate cancer is a blood draw. Come to the clinic, talk about it, you get a lab order. So all those things really can be done through our clinic and at PSMC. So
that's cool.
Yeah.
We don't have to drive in.
That's right. So
very
those
far,
are
really.
those are things that we can do to take care of us.
But
and
probably make an appointment, or I don't know, for these kinds of things.
Right.
Probably vaccines too. Or
vaccines like childhood immunizations. You can actually walk in and have those immunizations done. It's really important though to have those well child checks. And so you have them at 2 months and 4 months, and I don't know the exact schedule, so I'm not going to say it. But
Phil's
at each
He's
of those,
the family nurse practitioner.
That's right.
So
It continues.
he's the family guy.
yes,
As an infant, it's roughly every 3 to 4 months, give or take, and then it expands to 6 months, and then it's annually from there on out after, say, the age of 2.
yes, perfect. And then you have to have the 5-year-old shots to get into kindergarten. Right,
yeah.
So, but generally you have those with a well child check. The thing is, that's why an annual exam is so important, because then you can discuss these screenings and get the immunizations at that point. And then if you just want a pneumonia vaccine or flu vaccine, you can call the clinic and just schedule a nurse visit, and you can come on in. So speaking of annual exams, that's something that's really, that is just preventative. And that's such a good thing. Phil, you're going to talk to us about the importance of having primary care provider, annual exams.
Routine, right?
Yeah, so I think a general pattern that we see quite often is adults not going to the doctor and then maybe coming in for an acute concern. And then I feel like it's my job from there to encourage the person or the parent or whoever to establish with a primary care provider, to do those annual screenings, to have a check system, and just to have somebody checking in on their well-being from time to time.
Absolutely.
Yeah.
Perfect. And then Phil is so good about just listening to the patient side and just really, partnering with the patient. And that is ideal family medicine.
Thanks. Yeah. So I try to make, my approach is to first connect with the patient. I try to get a feel for where they're coming from. And I try to position myself as a resource for when they have questions or concerns. And really to empower the patient to make decisions that are best for them and their families. I try to provide information, whether it's on screenings or immunizations, so forth, and then give them the information they need to move forward.
And that's key. And as a patient, you don't know these things. I mean, you hear about, a friend that has some kind of a cancer or is really sick with the flu or just somebody with high blood pressure that doesn't even know about it. And then we get into our 40s and 50s and we start having difficulty. We start having issues. And those can be controlled, when we're younger.
I like to emphasize to my patients that if you're, this one of the ways I try to draw them in is if you're taking care of someone else, someone should be taking care of you, and that's where we come in. And so if you're, say, your parent, taking care of an elderly parent or taking care of a child or spouse, that let's have somebody keep an eye on you and make sure covering our bases and checking on things and keeping you at your optimal health.
That's perfect. And then Phil, you are in such good shape, and I just have to say that you are. You are in such good shape, and you really promote that to your patients about physical health and.
Yeah, I try to have them be engaged with their health. I try to put them really in the driver's seat. And some things that I emphasize are, I call it basic primary care. I like to talk about nutrition, sleep quality, mental health, And I don't really talk about fitness per se, but maybe movement. The importance of staying active throughout life. Does not have to be in a gym, does not have to be really regimented or rigorous, but just move your body. Your body's meant to move. And
There we go.
And those other things. Like I like to be proactive rather than reactive.
Mm-hmm.
Yeah, he's going to go swimming with his wife after this.
Swim date. Yeah.
A swim date, I love it.
And speaking of being proactive, so someone is looking for a primary care provider, and they call the medical center at 970-731-3700. And
Perfect.
how long, like, are there long wait times for appointments? And
No, there are not.
How long, like, you make an appointment with, say, Phil Zappone, and
Phil, I
You know?
think that you
I think
are
we're pretty available.
available
Yeah.
within at least 2 weeks.
Definitely.
I mean, that is amazing.
that's cool because you hear stories about some of these,
yeah.
situations, especially with the specialists and stuff. You know, just
Right.
like, 8 months.
That's
I'm
exactly
like, are you
right.
kidding?
Right.
I need help now, you know?
But I have to tell you that the specialists that we have, I mean,
Yeah.
Pagosa is so lucky to have
Yeah,
so many specialists
right.
that they can get in much quicker than our specialists in Durango.
I was referring to the
Yeah.
ones in Durango or
Yeah.
Santa Fe or wherever. They're
Right.
just like 6-8 months
They
out.
are. They
you
are.
know? So,
So,
I think we have. I think each provider has a bio online, and I encourage people to check them out and see who resonates with them, and then
good
go from
point.
there and call to
That's right.
establish with a primary care provider.
right.
Yeah.
And we have, oh my gosh, like 4. We have 4 family physicians. We have, let's see. Well, just you are the nurse practitioner because our other nurse practitioner is walk-in and doesn't accept, long-term patients.
Sure.
And then we have
3 PAs.
3 PAs. Thank
Yeah.
you, Bill.
PAs.
Yeah. That's a physician assistant.
Okay. I don't know. This is my.
Oh, there you go. Yeah,
is that
there
the
we
sheet
go.
There?
Yeah.
So that's fascinating. Yeah. And again, you got quite the crew there.
We really
and
do.
It's a team, you know.
Yeah.
I think we have an excellent group of providers and
Yeah.
nurses. I don't think I would send my family member to any of them, and I don't think anybody's there just going through the motions. I think they're engaged and passionate about what they do, and they care for their patients.
Absolutely.
Yeah.
I totally agree. I've been a nurse for over 40 years. Oh my gosh, I'm kind of confessing my age here. But I've been in a ton of clinics and a ton of medical settings. I am so impressed with our clinic and just the clinical, I call it acumen, just intelligence of our providers. And in a rural setting, you have to have that because you can't just, be this triage where you see something and then send them to the dermatologist, send them to a gastroenterologist. You guys live here, and we need somebody to help manage you long term. And that's going to be your primary care provider. And actually, they can take care of like up to 95% of what goes on with us.
Sure, that makes sense. And also, as primary care physicians, do you have shifts at the clinic too? Do you rotate through that way, or is it? I don't know.
Okay.
Is that a fair question, or I don't know?
Yeah. So we are open from scheduled
there you
appointments
go.
are like 8 to 4:30,
Yeah.
and then we have a walk-in clinic just
That's what
for
I was talking about.
right.
Yeah, that, okay.
A walk-in clinic that is from 7:30 to 4.
Yeah. That
And
sounds right.
and so those are just for acute illnesses. Like if you have a really bad sore throat, or you have a cut that may need stitches, or things that aren't like emergency. That is what the walk-in clinic is for.
Oh, yeah.
And we have a couple providers that are consistent walk-in providers, and then we do have the rest of them rotate.
That's what
Right.
I was. Yeah,
Yes.
that's the sense I get.
Yes.
Yeah.
Yeah.
Thanks. Well, let's take a quick break, and we'll be back with Pagosa Springs Medical Center. Tamra Lavengood, Clinic Director, and Phil Zappone, FNP-C, Primary Care Provider. And this is Good Morning Pagosa on KWUF, brought to you by Homespun Hot Tubs, UPS, ChemDry, and PSMC. We're just wrapping it up, but
Right.
Tamra or Phil, anything else you want to say?
There's one other
Yes.
thing. So our hospital is partnering with this nonprofit, and they're called Who We Play For. And they're actually, their mission is to prevent this thing called a sudden cardiac arrest, which is, it's a sudden cardiac death that, happens in our youth. And it's different than a heart attack. A heart attack is more vascular related, where there isn't oxygen to the heart.
Is it
but
sports related or anything like that?
It's actually where it's kind of the, I would say, it is an electrical disturbance.
Like a
in
cessation
the
of the
heart.
electrical activity?
Right.
Yeah.
And caused by a blow to the chest. We all remember Damar Hamlin. And,
Right.
Monday Night Football, and he drops, and he
Bills.
is Buffalo Bills?
Yeah.
Okay. And, they had a defibrillator right there, and they did CPR, and they were able to revive him. And so this organization actually is into educating, middle school and high school students on how to do CPR, how to do that defibrillator. But the coolest thing is that they offer EKGs, and this is national that this organization is around. And the coolest thing is that we are going to have right now there's going to be 2 clinics, and they're going to be at the high school and then also at the middle school. One is February 23rd, and this is going to be in the middle school, and kids are going to be able to just have an EKG. The screening is free, thanks to Pagosa Springs Medical Center. They're paying for it. And then I'm going to give you the website. So it's www.whoweplayfor.org. And you go on there and you can register, and you can have your child get an EKG, and then pediatric cardiologists are going to interpret it. You'll get your results in about 7 days. So this is such a cool opportunity for our youth. Things that you think about during sports are going to be like a baseball hitting the chest, sure, or a helmet hitting a chest, but not only athletes. It's
all students.
Yes.
Oh, that's great.
Yes.
Yeah.
It's available to everyone. Even an airbag can do this.
Sure.
Pretty wild. Well, thanks. Yeah, whoweplayfor.org.
Lots of information on their website. Talks about who founded it. And I don't know all the facts, so I'm going to refer you to the website. It's really a cool thing.
Very cool. All right. Well, good job, you guys. Anything else?
I think we covered it.
Thanks,
Will.
Very good. Yeah, it's 8:33, so we're right on schedule here. I want to thank the Pagosa Springs Medical Center and Tamra and Phil for dropping by. It's good to see you guys again.
Good
of course.
To see you
Thank you for having us.
And thanks for everything you do. You guys are awesome. And our hospital is just fantastic. So we're so proud. So good work.
Thanks.
Team.
Thanks.
Go team. All right. So we're going to get to our Western Ag news next. We'll see y'all later. Have a great day. Great weekend.